guys, I'm here today with Dr. John Wittle to talk genetics, kinesiology, and overall gut health. Thanks so much, Dr. John, for joining me today. Could you quickly tell our audience who you are and what you do?
Hi, Anita, first of all. I'm very excited to get to speak to your listeners. I personally started out as a chiropractor nutritionist, but as I was trying to find the real causes of my patients' problems, it got me very interested in applied kinesiology and then into functional medicine. Knowing the name of a disease does very little really for telling us how do you figure out how are you going to correct that problem when you look into alternative healthcare and alternative options. If you find the imbalance in a body, you obviously then need to learn how to correct it. So I've been in practice for 19 years, and I pretty much continue to always expand my knowledge into nutrition and genetics and functional medicine and neurology and physiology and all these different fields because any problem can really be caused from anything. And that's also kind of how we met is because gut health is an extremely important part of that.
Absolutely. And I love how you said that knowing the name of the disease doesn't necessarily tell you how to treat it. It doesn't even necessarily tell you much about it, the pathophysiology, because as you know from looking at current science and ongoing research, we're still discovering so much about so many disorders, and we're still discovering how to treat things and how things come about. So that's definitely a great point you make. So I want to ask you, what initially sparked your interest in the topic of gut health then?
Really, Justin, I briefly kind of said it was my patience, and understanding, our gut is our number one line of defense for our body's immune system, and our digestion is pretty much how we survive. It's not a question of you are what you eat; it's also you are what you assimilate of what you eat as well. And virtually every single health ailment that's out there has some sort of a GI component, either caused from it or then causes it. And as I'm trying to always find how do you help the person in the most effective way, doing it through food and nutrition and understanding where the body might be toxifying itself is of utmost importance. And everything always seems to involve the gut on some level.
Absolutely. I was nodding my head through that whole thing there, so I absolutely agree with you. On that note, I know that when it comes to the gut and your health, you actually went through quite a rough time with your health for about 18 months, which we've previously spoken about. So do you want to just tell our audience a little bit more about that time and how you began to recover?
I would say it was an understatement that it was a rough time of my life. I had kind of, I guess, been spoiled in athletic and very healthy person. I had been maybe sick twice in over a 20-year period. No colds, no flus. And again, I'm around patients with all kinds of illnesses and kids and never got it because I had a good immune system. My only real issues I would get would be GI related, but that was I've traveled all over the world for education, and I like to try anything. And so you eat raw foods or risky foods, and you you deserve the consequences, shall we say, sometimes. So in 2015, I actually underwent major oral surgery for, not worth getting into the why right now, a bunch of excess bone removed from my mouth. And then after that surgery, I developed a secondary infection. So at this time that I had this major surgery and I've got this really bad oral problem, I no longer could eat right. I wasn't even able to exercise right. I had gotten drug into a legal issue, which was causing me to not sleep well and insomnia. I had active identity theft going on. So I had this kind of epic stress from all directions and no real way to counter it, actually, while also still trying to, live my life, help my practice and my patients and such. So I very soon developed heart symptoms, which I actually did self-diagnose. I tried several of my holistic outlets with very little kind of resolve, but I knew something was definitely wrong. And so in January of 2016, I went to a cardiologist for the first time I had been to a regular doctor, shall we say, in decades. And they found 5 blockages up to 99%, including my left anterior, which is the widow maker, which is typically the one that causes a very massive heart attack. I would be a classic case of a person who just felt out of shape and said, I haven't been exercising, I need to go for a run. And I would have died, 2 miles from my house in the middle of the park kind of thing. So I went to the doctor, and I pretty much went straight to the front of the line. Within 1 week of seeing him, I was scheduled for an open heart quintuple bypass. They ended up doing a quadruple bypass um, within that first week. And so that kind of started a whole different level because it's a very life-changing surgery.
Hmm.
Having my background in nutrition, I kind of recovered on the surface very, very quickly. 8 weeks after my surgery, I was performing at above average normal levels. I was considering running a half marathon. Everything looked great, but knowing what I knew, I wanted to find what were the under. Have I really corrected it? And that's when I realized I had a long way to go. So what I was doing at the time, I was doing a lot of self-evaluation and tracking my own, vital stats. And I was really trying to deal with my blood pressure was one of my major notes. And I would find that whenever I would deal with my gut, or I would, actually at the time, when I would try with dealing with my gut, I would have blood pressure issues. And over the summer is when I started to really respect how important this was because I'm doing all these different cleanses and my blood pressure would start to go crazy. And in reality, now hindsight, which is always a little bit better, I was actually pushing my kidneys really hard, and that's what was driving the blood pressure problem.
Mm.
So once I kind of discovered that, then I started looking at all these different protocols, and that's when I started to really look at the genetic aspect too. Because while what I used to do all my life, and I take very high-end nutrition, worked for me great. So I kind of had this is good for me. But because of this huge, massive surgery, I kind of skewed off my whole genetic kind of methylation pathways and such. And the supplements that I was taking was actually hurting me. And in some ways, I was doing damage to myself by taking good supplements. And that's when I got very, very obviously investedly involved in both the gut and then also nutrition and understanding the genetic concepts.
Hmm. And that's really interesting that you mentioned how you actually got worse a little bit from taking high-end supplements, because that's one thing that I'm always mentioning to my audience and to my clients is that a lot of people do decide to go out and grab these supplements because of some information that they've heard on them. And they actually end up pushing their body in the exact opposite direction that they want. So it's a great lesson to remember that even though, they are nutritional supplements, not necessarily the same supplements are going to push your body in the direction that you're looking for. And these things do need to be personalized. So it's a great thing that you had the background to do that. Not everybody does. So, we're proud that you made it through and you actually were able to recover. And how's your recovery going now? You're nice and healthy?
Yeah, again, it's one of those on the surface. I mean, I do, high mileage walks and runs, and I play tennis as
Right.
kind of my sport, and I look great on the surface. I still actually, even today, and now we're a year and a half later, my gut, things still are going back to the gut. That's
Hmm.
still where there's imbalances that have not, the blood pressure's been fine. I've really got myself to where most people would just think, hey, I'm healthy now. But because of what I've learned, I still know it's still not right, and it's definitely a complex case to figure out, shall we say?
Exactly. And you definitely become more self-aware once you've gone through something like this. So it's great to have that awareness and project that into what's actually going on internally rather than just a lot of people do tend to brush off these symptoms until they get to a different level that's obviously a little bit difficult to deal with. So that's great that you're being self-aware. We're obviously glad that you're better because you're here to talk with us today. And
Exactly.
and as you said, you look fantastic, which is one of the best parts. Moving on, you've got a great educational background in many areas of health. You're experienced in everything from Chinese medicine to nutrition to chiropractic to kinesiology. But when it comes to diagnostics, you focus more heavily on a combination of genetic testing and kinesiology. Could you tell us a bit about what each of these areas entail and why you've chosen them in particular over the other areas?
Yeah, there's never one test that can paint a whole picture.
Hmm.
As I always tell patients, even if you get a blood test, a blood is a moment in time. So you get a lot more information about a person as you would have multiple blood tests because then you can start to see a pattern. You can see, are things really increasing or was just a fluke because maybe you worked out too hard the day before. With genetics, just because you have a genetic defect, it doesn't mean you're going to develop that problem, because there's too many. It's so complex and there's so many different fail safes. So if you look just at the genes, it doesn't really tell you where to look either. And if it does, let's say you've got something like a VDR gene, which is when people don't make vitamin D properly, and that's pretty simple. That's okay, you need to take vitamin D regularly because your body doesn't manufacture it. But in a lot of the other genetic defects, there's multiple different nutrients and such that could potentially be the cause of that pathway not functioning as well as it is. Mm-hmm. So I kind of try to incorporate all regular lab work, doing stool tests, doing blood work, including looking at someone's genetics. And then that's where I also use like my applied kinesiology and other like muscle testing methods to get a physiological response of how does the person actually relate to it. So it's not just based upon empirical science, and it's not just based upon doing a muscle testing kind of background, because there's a lot of flaws in both sides. It's really trying to incorporate them to figure out, what do we think is the biggest problem, but then what can we actually affect, and then how do we most effectively make that kind of a correction?
Mm-hmm, absolutely. And that's a really great point, how you say a blood is just a moment in time, a blood test, because that's one thing that, for example, I like to track my everything going on, my biological markers as well. And a few weeks ago, I actually was headed to get a blood test, and I had a stressful event happen the night before, a very stressful event. And the next morning, my husband said, why haven't you gone to get your blood test? And I said, well, it was the same point, that the results of the blood test are going to magnify that moment in time, that stressful moment where your biology is reacting. And so a lot of people definitely don't realize that, but if you are going through a particular period in time, or having a particular day, that's definitely going to show up on your blood test and can absolutely skew your results. So a combination of diagnostics, as you do, is a much more accurate and effective way to get at all different angles and to come to a realistic diagnostic result from that. So I definitely have a lot of appreciation for what you do. As I said, you're well educated in many areas that beyond what most people are. So that being said, I'm sure you see a lot of patients for all these different areas, and I'd like to know what the most common misconception is that you actually find your patients have surrounding their health. And in particular, is there anything that you see people commonly doing that they don't realize is actually quite unhealthy or could be propagating their illness? Just as in your example, you were taking high-end nutrition and didn't realize it was pushing you in the wrong direction. What's a common misconception you have with your patients?
Oh, that's a loaded. There's so many things. Definitely, yes. One is people will listen to everyone. Yeah. You're just because something helped one person doesn't mean it's going to help you. Mm-hmm. I specifically didn't mention the nutrients I was doing last summer that helped me or that hurt me, because that was my specific imbalance. So while I needed to, let's say, get there, because now that I've prefaced that, that doesn't mean the next person, that's what they actually needed. In my case, it was making me worse, but in this case, that. So it's not a simple thing of because this worked for me, it's going to work for you. It's that puzzle, and everyone's puzzle is very unique. In my personal practice, I'm often taking people off supplements as much as I would be recommending something. So my biggest advice, don't blindly just take supplements without having other kind of documenting factors. When I did my recovery, you just mentioned you do your biomarkers. Every morning for about the first year of my recovery, I would take my blood pressure and I would, check my weight and do my pulse ox and all these kind of, biomarkers. And I got to the point where I literally could pretty much tell you within probably 2 points what was my blood pressure going to be, what was my weight going to be, and those fluctuations. When you have that kind of information, I would also have notes then of what was going on. What did I eat the day before? What was my stress level? How did I sleep? If I was making a change to something, I took myself off one of my medications myself as an experiment, and I noticed no change. And when I went into the cardiologist, they, of course, got very upset with me and, well, why would you do that? And you really need that drug. well, I had 2 months of data to essentially show that, well, what's the purpose of this drug? And
Hmm.
then show, but it's not affecting it. So it gave me the ability or the knowledge to then, in their minds, there's not much they could say, back to that. So if you have no baseline or tracking method, you're never going to figure out what the actual problem is. A lot of people bounce from doctor to doctor, and this helped and this didn't help. Or it's really this didn't help and this didn't help. And I've seen everybody and no one's helped me, when in actuality you should be learning then maybe why this didn't help, or, well, I now know that this isn't really an immune problem, but it's more a nervous system problem, or it's
Hmm.
more of an endocrine problem. Being able to use what hasn't helped me to also figure out, well, what's my next step. So the other big one, I guess, that I always tell people is, you have to take responsibility for your own health. Because if you go to 5 different doctors, you're probably going to get 5 different opinions
Hmm.
and 5 different corrections. And it gets very confusing. Even in my field, I would go to my mentors who have been in practice 40 and 50 years, who, I would call them the elites in the world. And I would get very frustrated because I would get 4 or 5 different opinions
Hmm.
from them. One would say, oh, yeah, it's your gut, but you need to do this for your gut. And the next guy would say, oh, no, that's wrong. You need to do this for your gut. Um, so I kind of had to take it on myself, and really try these things, but also, again, documenting, having baselines, having something so you can then get frameworks for why this maybe didn't work or why this did not work.
Hmm. Absolutely. And that's a great point you make too about just being more self-aware and documenting things in yourself, because I think a lot of people are conditioned to feel like that's not the right direction to go, because really, when we do talk to a lot of modern medical doctors today, there is, as you said, you kind of played doctor for yourself and went and reported that to your cardiologist, and we're told to not be so self-aware and not overthink it and not make our own decisions for ourselves. But in reality, like you mentioned, you can go to 4 or 5 different doctors and get 4 or 5 different diagnoses. So by being more self-aware of what's going on with you, you can simply gather more data for yourself, help yourself to be more aware of what's going on, and then use that data in conjunction, in collaboration with a professional, to help you translate that info into the scientific basis, into the scientific needs that you have, and then actually take that and go down a treatment route. So I love that you are so into self-tracking. I'm so into self-tracking too. I'm constantly monitoring all my body fluids, and people are
You
wondering
did
why.
bring up a point, just to interject, if I may.
Yeah, go for it.
While I'm saying, here I was my own doctor in that, well, I was my own data collector in that.
Hmm.
The one piece of that, though, is you don't want to be your own doctor, because
Hmm.
we are our own worst. We don't see those problems, so you want to find it, but you need to gather that data, know about yourself, so you can ask the next person. But
Hmm.
in no way, I needed a cardiologist to do that. There's no
Yeah.
way I would have fixed my heart without, that
Yeah.
surgery.
Uh,
So it's kind of that, yeah, you're responsible for yourself, but at the same point, you need to trust in your doctors, and, find, if someone doesn't do what they're supposed to. A great example, I have patients, they'll go to their gynecologist, and their gynecologist, they'll recommend, the supplement of the week, that
hmm.
everyone's taking
Hmm.
suddenly. And then they'll come up in with this terrible supplement they got at the store that's just like calcium carbonate, and just a really crappy supplement. And I'll be like, "Oh my God, where'd you get that?" And they'll say, "Oh, my gynecologist recommended that."
Hmm.
And I say, "Okay, that's fine. That doesn't mean your gynecologist is bad at what they do.
Hmm.
That just means don't get nutritional advice from your gynecologist." So it's
Yeah.
sometimes, people, it's not to put them down. It's just, okay, now they've proven that they really aren't sure what they're doing. So yes, you want to be in charge of yourself, but you don't want to, be your own doctor, I guess you'd say.
Yeah, and I completely agree, and that's exactly the wonderful place of the practitioner is like I said, they're there to they're experienced in translating the scientific data, in looking at the symptoms, and really being able to come up with a diagnostic and a proper treatment and intervention plan. And so that's where they're so vital. But as I said, being more aware of yourself and taking that information to collaborate with a professional is such a great way to put the most information into the professional's hands, so that they can make the best decision possible. So I totally agree with you there. We're definitely on the same page. And yeah, playing doctor when you're not 100% sure what you're doing is definitely not the best idea. But yeah, self-awareness is always something helpful that is, not going to hurt people to just simply gather more information as to where they're at in their health. So yeah, that's a great point you make. I'm so glad that you went through this journey and were able to learn so much more, because so many people that I speak to who have gone through a health journey have done some extensive research. So to see a doctor such as yourself, who has both the educational background and the personal background, is a really admirable thing. So where can people find you? Where can our audience find you if they want to get to know more about you and your work, Dr. John?
Well, my practice, I'm in Atlanta, Georgia.
Mm-hmm.
I'm a bit of the older generation, so I don't have near the online presence as someone like yourself, but which is great. Our website is akdoc.com. I do have a new doctor that's joining my practice who's growing our Facebook presence. Our Facebook page is the Applied Kinesiology Center, and then I bet you I'm sporadically on Twitter, but I don't do near the amount of good information that you put out. But I definitely see such a fantastic benefit from what you're doing to give people education on alternative viewpoints. Because as you mentioned, science, sometimes it's hard because the science of one year, this is what you're supposed to do, and then 10 years later, there's a new study that says, oh,
Mm-hmm.
no, that's totally wrong. So there is that grain of salt sometimes with science of looking at, who funded this,
Yeah.
I have obviously when you look into heart stuff in my journey, with cardiology, everything's about cholesterol, and everyone wants to blame cholesterol, and they will be so matter of fact that there is nothing possibly wrong with statin drugs or cholesterol drugs. And yet every study they reference were done by the drug company that, has, an interest in coming out with a good outcome. So you've got to even take science sometimes with a bit of a grain of salt.
Yeah, absolutely. And I was literally this morning recording a YouTube video on this exact thing, because that's when it does take a good scientist or someone who knows what they're doing to look into where did these results come from? Because as you probably know, when a study is funded, it's 5 times more likely to come out with favorable results towards the
Yep.
funding institution. So, of course, like you said, science is even still something that needs to be questioned and critically analyzed. And critical analysis is a very, very powerful tool to be able to help us move forward and make the right decisions. So, I definitely agree with you there. Great. So, any last comments for our viewers before we head off, Dr. John?
No, thank you so much. I would love to in the future get to go into some more depth. I guess as far as what methylation is, or how the genetic pathways work, or some more specifics for people. But again, I think you have to have kind of that basis in the first point that
Mm-hmm.
there is no magic answer ever. There's no magic supplement. There's no magic drug. There's no, this works for everybody.
Mm-hmm.
It's understanding the big puzzle, the big picture, is how you get the best outcome.
Absolutely, and completely agree with you there. So, for all of our listeners out there, feel free to let us know what you want to hear from Dr. John. We can get him on the show for another topic very soon. Thank you guys so much for listening today. You guys can catch me and Dr. John conversing on Twitter. And don't forget to subscribe below. If you guys want a scientist on your side, this is the channel to go to. So, thanks again so much for listening, and we'll see you in the next episode.